everyone. Welcome back. As I say every day, for those of you who have been joining us for a while, I am super duper grateful. My name is Savannah Sellers. I'm an NBC News correspondent, and every day at 1 p.m. Eastern, I have been doing this live show here to tell you the updates that you need, but also the stories that you want to hear. I always try to make you smile because I'm trying to inform you, but not overwhelm you. That's my little saying. And I will always definitely try as much as I can to start with good news and bring you as much good news as I can, while also just updating you on stuff that you might really want to know. We are all hearing these headlines that are super scary and just, wondering when this is going to end, wondering when we'll get our lives back. So I know that there's a lot that you already know about, that you are dealing with. I'm not going to always just give you, the big major headlines that you might get anywhere else, but I'm going to try to give you some stuff that you might actually want to know about or that's going to affect your day-to-day life. That type of thing. So somebody says Atlanta here. Hello, Atlanta. Thanks for joining, and everybody else. Again, I'm Savannah Sellers, doing this every day at 1 p.m. Eastern live. So if you like it, come on back and join us every weekday at 1 p.m. Also, today a lot of my information is going to be based on questions that I've been getting, which I absolutely love that you guys are messaging me and finding me to send me things that you want to know more about. Actually, one of the things that I'm doing today was based off of, it's about those at-home tests, and somebody sent me all this information on it, so I went and looked myself. So thank you so much for doing that, and I'm going to include some of that. So if you have questions for me that I can answer or things that you want to hear more about, you can always find me. I'm at Watch Savannah, spelled just like the city in Georgia, and I'm of course trying to tailor this to what you guys actually want to know. So anyway, let's get started with where we are at today. One of the big metrics about how things are going has been New York, since we were in such a bad place, and it does look like we have some good news, more good news here, because our curve has been continuing to flatten. It looks like NYC here, Reno here, hello everyone. It does look like our curve is flattening, and maybe even potentially we are starting to come down that other side. We are sort of the curve, it goes like this. We are kind of here, and it's starting to go like this because things are dipping. The number of people with coronavirus admitted to hospitals and the total number of intensive care have both declined. That is great news. The other big story about where we're at today is less good news, but is not totally unexpected, so I don't want to alarm you or anything, but it's about unemployment. I know that's something that a lot of you guys have been sending me questions about, people detailing for me in my DMs their struggles with filing for unemployment because of how difficult it's been to get through, just because of the sheer volume of people who are trying to do so. The phone lines have been unable to be answered, even though states like New York and California are employing more people and working with tech companies to try to be able to answer all of those calls. Web portals have, even in New York, one was created in partnership with Google. They've been slow to be working, so I know it's frustrating, but our government leaders are assuring that people will be retroactively paid and that you will have this extended for longer than normal unemployment benefits. So hopefully that will help you out when it does actually come through. But another 4.4 million Americans did file for initial jobless claims last week. We don't know exactly if maybe there's more, because like I said, so many people are trying to get through who have not, but 4.4 million people did get through last week. So now that's at least 26 million people who have requested unemployment benefits since the beginning of this coronavirus outbreak. And actually what's so startling about that number is that in just a month, all job gains since the Great Recession have disappeared, and the economy had created around 22 million jobs since 2010 during this historic decade of economic expansion, and that has pretty much been wiped out. The hope is that with things like the Paycheck Protection Program, which was that small business loan program that ran out of money but now has more money, with hope that more small businesses are getting the assistance that they need. Hopefully people will still be able to be paid, and then of course hopefully the economy can reopen soon. In some places the economy is reopening. We talked about that earlier this week. Places like in Georgia as early as Friday, nail salons, barber shops, gyms, stuff like that will be opening. A lot of people on here had said that they think it's too soon, and actually the president has sort of reversed what he said and said he too doesn't really know that he thinks that it's time. So A lot going on, a lot of different opinions. You guys can keep letting me know what you think about all these things in the comments. Also, you can be sending in questions that I will answer as I can in a little bit. Okay, one of the big things to talk about today, and we've talked about this before, and this was a big talker, and I got a ton of questions about this, so I thought it would be a good time to do sort of an update based on some new information, and that is pets and animals. Okay, so this is not great news, and I know that it's all sort of confusing and a little bit frustrating, and I'm sure there will be questions that I and no one has the answer to yet, but two pet cats in New York State have tested positive. They weren't near each other or anything. They're in two different parts of the state. It just so happens that they're both in New York. The cats were showing mild respiratory illness before getting tested. So the first cat, no one else in the house tested, no one else in the house has it. Now, they don't know how the cat got it. They could have been an asymptomatic family member who hasn't been tested, or a person outside of the home. The second case, the cat's owner did test positive, and then the cat showed signs. So somebody was sick, they got tested because they were sick, and then the cat started seeming sick. And again, in these cats, what it's looking like is mild respiratory illness. The one big thing that was the big question before that there is still no evidence on is there is no evidence that they can spread the virus to their owners. There's no evidence that pets or animals, for that matter, are transmitters of the virus. According to Dr. Anthony Fauci, who is the nation's top infectious diseases expert, he said, "Is it impossible? No, but we don't think so, and there is no evidence that pets are transmitters." Now, so basically, the whole bottom line on this is that your pets aren't transferring it to you, but you, it does seem, could potentially transfer it to your pets. Again, these two cats in New York State, one where nobody in the house seemingly has COVID, but the other where someone in the house does. So one of the big things that I thought was like kind of important for you guys, he said, did the cat have suitcases? Was it traveling abroad? Majimoto, you're a jokester. One of the things that I think is really important to note about this is some of the guidance that's coming out about it is that you should not be letting your pets interact with other people or other animals outside the home. I don't know if that seems obvious to you guys, but I don't have any animals. I wish I had a dog, but I don't. But when I've been just out getting some fresh air in New York, or even just on a quick walk to the grocery store, I'm totally seeing animals that, like two dogs that are, sniffing each other. Their owners have them on leashes. And the owners of the humans, the dog's humans, are 6 feet apart, but the dogs aren't. They're sniffing each other. And now this guidance is coming out that you should not be letting your pets interact with people or animals. So you and your dog, or your cat, if you walk a cat, should remain 6 feet away from people and animals. I just think that that's like a good, useful piece of information because that's something that I'm not seeing other people doing. Also, if you are sick, you should restrict contact with your pets. Again, I want to stress that these animals are expected to make a full recovery. The other thing that I hadn't heard about in a while, and so I looked into it today, that I know we talked about and was the big talker here, was that this kind of all started, the talk about can it affect animals, with a tiger that was infected at the Bronx Zoo. The tiger was showing some signs of respiratory illness. They tested him for COVID. The tiger had it. Well, now 8 big cats at the Bronx Zoo actually have it. They are all expected to make a full recovery, but I just thought that it was interesting. Also, one important note, the CDC is encouraging people nationwide to please not try to get your pets tested. Some of these have been being tested as we're trying to sort of understand what's going on. It's not recommended, though, that everybody runs out and gets their animals tested. And again, I want to stress that these animals are expected to make a full recovery. There's been no case that we've heard of so far that's been reported where any animal who contracted this was in any way expected to not be able to recover from it. So, you don't really need to get them tested if there's nothing that you're going to do for them and if they're going to be okay. One other thing that we had a lot of questions about yesterday, and I know that this is scary to talk about, but is the potential of this second outbreak. So there's been some, back and forth, as there is with quite a bit, always and now, which is unfortunate. But President Trump was sort of downplaying the idea of the second outbreak, or downplaying how bad it was going to be. But top experts are saying that it is likely that it's going to come back in the fall. Dr. Fauci was saying we will have coronavirus in the fall. I am convinced of that. That is exactly what he said. He believes, though, we will be better prepared to deal with it. So that's great. Better prepared to deal with it. If it's big or small, depending on if this outbreak in the fall is big or small, it depends on our response. Again, it is us staying home. It's us social distancing. It's us wearing those masks. It's us washing our hands. So let's all keep doing that. All right, the last thing before questions and something to smile about was the at-home test, which was something that I talked about yesterday. And I think that I know that a lot of you were interested because that was the majority of questions we got yesterday was this at-home test. And I just wanted to show you a little bit about it. And this was what somebody had sent me all this info on. So there's this company at LabCorp has designed the first FDA approved at-home test but what it is it's the collection kit for your sample. So you don't actually test yourself. A lab still tests you, but you are able to collect your sample at home. That's good because healthcare workers don't have to be getting closer to you to collect your sample. And also it's a little bit quicker, and the results you are getting within 1 to 2 days are hopefully more accurate. But it is available right now for healthcare workers. The company is saying that within the coming weeks that they hope that it will be provided to healthcare workers. Somebody just keeps writing my name in the comments. Savannah, hello. All right, so the company is LabCorp. There's this website. It's Pixel by LabCorp. I know you can't really see this, but I was just going to kind of go through how it works. So this is pixel.labcorp.com. And so what it is there's this COVID-19 test at-home kit. It's $119. Click on it. Then what you basically have to do is fill out a questionnaire. Again, it's $119 for this at-home test. I click Get Started. There's a survey. It says, are you a healthcare worker? Yes or no? I click no because I am not. And this is what comes up. It's a little notice. It says, with limited quantities of kits available, Pixel by LabCorp is currently prioritizing healthcare workers and first responders consistent with guidance from the CDC. We plan to make kits more broadly available soon, so please check back. So again, that is pixel.labcorp.com, $119. The other thing that I thought was sort of cool is just seeing how it works. So you purchase your tests, again, for $119 on their website. Then you provide your sample. That's what this collection kit is. It is you actually collecting your own sample, and in this case, it's a nasal swab. And then you send them back into the lab, and then you're just able to access your results online, which I just think is pretty neat and hopefully will be helpful. There's literally these little diagrams on here that's like, complete a short eligibility survey, which is what I just said about the healthcare worker. If you're eligible, purchase your kit for $119. Then you receive your sample collection kit via FedEx. Then you collect your sample, send it back, and then you access your results online. So that is that. You guys can be sending in questions. I am now going to show you something to smile about, which is what I try to do every day. So I just thought that this was so cool. I love talking about people who have overcome this virus so that we are reminded that that is something that is indeed happening. While at the same time, of course, people are losing loved ones, which is so tragic. But people are also recovering, and we aren't talking about that so much. So this right here is Paul Lee. That's Paul. And Paul had actually finished radiation treatment for cancer back in November, and then he ended up back in the hospital with COVID-19. So in just 6 months, he is a father of 8, by the way. In 6 months, he has beat both cancer and COVID-19. And when he came home from the hospital this time, these are his neighbors lining the street for a little parade for him, welcoming him home, which I just think is so sweet. He had several close calls while he was in the hospital, but eventually he was cleared to return home, welcomed by that parade of neighbors, friends waving signs, wishing the family well. Neighbors parked on either side of the road holding up these homemade signs, making noise with cowbells, cheering for Paul and his wife Julie as the couple drove by to come back home. So again, in 6 months, beat both cancer and COVID. People are beating this. All right, let's get to some questions. Somebody asks, are other parts of the world seeing a second wave yet? That's a great question. No, because we pretty much have been in the first wave still. What we do know is, like, for example, in China, who, by the way, is reporting that there are only 1,000 active cases in China right now, which is the lowest that it's been. I will caveat that with, we are taking numbers that are being reported out of China with a grain of salt, because there has been some reason to believe from US intelligence that they have not accurately been reporting the number and that they have been downplaying it. So China's saying that they only have these 1,000 active cases, but there is a different city in China where they are now tightening up lockdowns. It has an outbreak with a number of cases just in the 50s. But it is the highest sort of new hotspot in China, and they are tightening up that lockdown. But I don't think that we would call anything a second wave yet. We have not seen, this dramatic decline where it's sort of quieted around the world and then come back up and sparked again. But it is still, going in all of these places that we have seen it. In Italy, in Spain, all these places that have been super hard hit. And of course, here in the United States, we are sort of still within that first wave. Somebody also asked about the pets. I knew that this would be a talker today. How do you know if your pet should be tested? So again, the CDC is urging everyone nationwide, no matter where you live, to not be trying to get your pet tested. Do not go rush to do that. So the answer is really just that you shouldn't be trying to have your pet tested. The question was, how do you know if your pet should be tested? However, obviously, if your pet is super sick, of course, talk to your veterinarian and they will be able to, guide you in the best way. But it's not something that's regularly happening. It's not just like, if your pet doesn't seem right, people are testing them for COVID left and right. So that's an important one. Somebody just asked, are we getting another stimulus package? We do not know yet about those checks, those, like the first stimulus package, the $1,200 checks, which, by the way, if you guys, I've loved you guys messaging me to tell me if you have or have not received them. So if you keep doing that, I'm able to sort of give more information here anecdotally about how, if people are actually receiving those checks or not. What we do know is that it was just passed and signed in that we are getting another small business loan. More money is funding the small business loan program. So that Paycheck Protection Program, which is going to small businesses. Somebody says, I got my check, woohoo. This Paycheck Protection Program, that is extremely difficult for me to say, that is being replenished with money. After the first time when everybody was applying for those loans, small businesses were applying, it ran out of money really quickly and a lot of businesses were not able to get any of those loans. So now there is more money. So hopefully for those of you who have a small business who are trying, I'll be thinking about you and I hope you get it. The other day I talked about sort of what you can be doing now, and it really starts with checking with your bank about where you are in the application process for that small business loan. Of course, for a lot of small businesses, an organized and digital payroll is not necessarily something that everybody has. So this is the time right now to be getting that straightened out, to make sure that you have all that information, your paperwork, your payroll, in a way that it can be, turned over to your bank so that your application can be completed for that small business loan. So make sure you check with your bank and see where you are in the application process, and you might actually be good. And then there's nothing that you can do right now. You're just waiting to hear back. All right. Somebody just said, I missed the first PPP wave. I should just call it PPP instead of trying to say Paycheck Protection Program every time, shouldn't I? I missed the first PPP wave. Has it been funded again? It has. It has indeed. That was just signed in. So people, you haven't missed anything yet. You should not have found out if you've been approved with that second round. But that is coming. So make sure you are in a good position with your bank to have everything done. All right, you guys, I have been talking for a while. I say that every day at about 20 minutes or so. So thank you for listening. Thank you for writing. Thank you for your questions. Again, every day I am here live at 1 p.m. Eastern to give you the updates that you need, but also the stories that you want to hear. I am at Watch Savannah on Instagram. And I am looking for your questions and, what it is that you guys want to hear about. Every time that I get messages about certain things, that's kind of what's informing. Just like the pets was a big one. So that was a big deep dive for today. All right, you guys, stay healthy, stay safe. For those of you who are sick or who have a family member who's sick or have lost somebody, I am so sorry. I'm thinking about you. We are all in this together and we will get through it. And I will see you every weekday for now at 1 p.m. Eastern right here on this account. All right, see you guys tomorrow. Have a good one.